what caused that person to poop out at the end? Why couldn't they? Did they have fatigue issues? Did they have muscle endurance or strength problems? What was it? Did they get dizzy? You know, so we want to give an explanation as to why, what the rationale is, what our opinion is. Okay. Anything to add with that?
Yeah. No. Just thinking.
Yeah.
You want the tactile cues and the verbal cues and stuff in Yo or the A?
All right, it's a good question. All right, so, Dina, what do you think? Where are you going to put tactile cues?
Well, I actually put it in my objective, but I did put in my assessment, patient needed multiple verbal cues and breaks throughout therapy sessions. Yep. So,
Okay, so it begs the question, can it be in both? Is it wrong? I don't think it's wrong. It's not wrong.
But I would say in the assessment, you might, if you have an opinion on why they need that they have memory loss or
Lack of motor control, motor planning, why did they need it? Yeah. You just go further, what?
Did you state your patient instruction in the assessment?
I put if I'm telling the patient, if I'm reviewing a home exercise program, or I'm teaching a family member how to do with their spouse or whatever, I put it in the objective, because that's where I'm doing it as the therapist. Yeah, now on the assessment, I might say, patient spouse had difficulty recalling 2 out of 5 exercises due to some confusion as expected for someone who's 87 or something. I may give a reason why they were only able to recall 2 out of 5 exercises to review with their spouse. So you want to give them more information as to explain it. Okay? Yeah.
I wanted to get your opinion on this one. I've heard this from a couple different places. So, the dreaded patient will benefit from continued physical therapy.
Okay.
With that, I've heard a couple different sources.
Yep.
Assessment or plan. Like where does, because I've heard that should be in a SOAP. Like patient will continue to benefit from physical therapy, interventions such as therapy, exercise, blah, 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 whatever it is, that's got to be in there somewhere to showcase that they're continuing to need physical therapy.
Wouldn't that be the definition?
Yeah, that's a very good point. What do you guys think collectively? I know
I think it's
just an opinion.
Okay, you think it's plan? Okay. What do you guys think? Okay, what do you guys think?
It doesn't make sense in plan.
Yeah.
Okay.
Because that's our overall perception as to how the visit went.
Yeah, I mean,
that would indicate whether they needed.
I would put it in assessment. I would put it in assessment because I'm assessing the situation as to this patient requires more skilled therapy, and what defines skilled therapy are teaching of tactile cues, of motor planning, of hands-on therapy or facilitation or the skilled intervention that we can do.
Do you feel that that's a necessary component of it?
Well, I'll come. Yeah, I think so because I use myself for example. As a therapist, sometimes we get busy if we're seeing 7 or 10 patients a day, what it might be. I'm working, X amount of hours, and I'm trying to get my notes done, and I'm writing my notes. I may forget vital information in my note. So the vital information I might be forgetting is that, well, on Monday and Wednesday I did exercises that looks a lot like what I did on Friday, and I didn't vary it up. I didn't progress them. So a reviewer's going to come and they're going to say you did great. Visits 1, 2, 3, 4, 5, but now 6, 7, 8 they look the same. Where's the skill? So I'm going to have to write in my assessment why the patient needed to continue beyond the 5th visit, and if I don't do that, the onus is on me. I didn't justify clinically and professionally that is medically reasonable and necessary that the patient has me as a therapist to continue. So yeah, I mean I have to state that. If I don't, that's my fault.
Okay.
And in addition to that, I would elaborate, because what they look for in our documentation now is what, instead of how much progress the patient's making, I think I talked about this last time, but is what ongoing problems the patient has. So what we really didn't mention, which is what I was trying to figure out how to, is that patient's still unable to walk without assistive device, or walk on unlevel surfaces, or bathe or dress up. Not they're making great progress, continue for more, continue. It's like, okay, why do you need, they need to continue.
Yeah, and that's a hard concept, that really is, right? Is that
Especially
hard?
for us that have been doing this a long time.
Well, yeah, because think about it as a coach. If you're a coach and you're a basketball coach and you want to teach someone how to dribble and shoot foul shots, after 4 sessions of spending time with them to teach them how to do it, they should have the understanding how to do it. Now, they might have to practice on their own, but come 5th, 6th, 7th, 8th, if they need more cues, you're going to say, why isn't the patient improving? Is it a problem with the patient's ability to understand? Or do you have to do a self-reflection and saying, 5 visits, what am I doing wrong? How come this patient's not learning? This is my fault. Seriously, guys. So, you're going to have to decide what the problem is, why they're not doing good. Is it you as a therapist, or is it them as the patient? All right, and plan simply means that what are you going to, and again, this is where people get confused or where there's controversy. Some therapists will put, these are the goals, that's the plan, go after the goals. But I put my plan, what I want to happen the next visit or 2 visits at most. If I have this left hip concern, I want to make sure I address that for the plan for someone else to look at next visit. And what you're going to do next visit, increase the weight, increase the time of exercise, try and do a sideline hip abduction versus standing hip abduction. So it's a progression to make it more difficult.
You can still put to continue previous, but include or alter, because we're still gonna do some of the same stuff probably.
You'll have that grid that Dr. King has, so yeah, you're gonna do this grid of your exercises, and then, maybe on the grid, she'll add this and this, visit 5 added.
It doesn't have to be
6.
something completely different, as long as you show a slight progression of some sort.
Yeah, but it's gotta be skill, otherwise the reviewer, who's a nurse, is gonna, might be saying, this doesn't look like you did much for this patient. But yes, in theory, you could just make it a little different, but to really prevent a huge review, you want to make it somewhat obvious.
Yeah, for those of you, I think, Eli, if you guys have notes, I really am interested to see what I said to you, so I don't, and if it was something like, yeah. Yeah, when you have a chance, if you can somehow get it to me, not right, I have a comment I need to get on, but I'd like to see that so I can make sure that I don't continue to say something I don't mean.